When you're looking at contact tracing for COVID, it's a combination of epidemiologic factors and testing. So finding out what high-risk contacts the known case, the index case had. So people who were in close contact for a prolonged period of time. And things such as wearing a mask, if both people are wearing a mask, that turns that into a low-risk interaction. Whereas if the person who was infected was not wearing a mask and the other person also was not wearing a mask, that becomes a high-risk exposure, especially if that is a prolonged and close exposure. In general, the more you're able to identify who's infected and get them to self-isolate, the better you're going to be at reducing the amplification of this outbreak. What makes this one problematic is that people are most infectious about a day before they start developing symptoms. And so the normal things people would do, staying home, sneezing or coughing into their elbow, they wouldn't do if they're feeling just fine. And so this has made things pretty complicated with COVID, that even though you can identify cases and isolate the close contacts, because of the transmission that occurs before people develop symptoms, this really makes it difficult for us to eliminate exposures entirely. I think a lot of people are looking at new testing, rapid testing, as sort of our way out. And I doubt that's going to be our way out of this pandemic. In part, these rapid tests still need to be done by healthcare workers. So we don't have the kind of pregnancy test that people can just do at home. And so these tests still need to be run by a healthcare worker. So if you're imagining testing a stadium of 40,000 people, that's not going to be feasible because they still need to be run. In fact, the more tests that you have, you really very quickly overwhelm the ability to run them. And so I don't think we're going to test our way out of this pandemic. And in that way, contact tracing is very important, but is on its own not going to eliminate the pandemic.